All right, here we're going to talk about tissue release and some of the modalities that you can use to actually do a form of self-massage and release technique. So this can be very valuable for problematic areas. So let me go over a few things related to the tissue release techniques. Give you some examples. Usually there'll be some kind of a hard rubber ball or a roller or something that you're going to use to actually put some pressure into some little areas where you have maybe some discomfort and excessive tightness. So the idea is really to help release some of that tissue so that you can move through that range of motion a little bit more comfortably. So typically, just to give you a little background on the release type techniques, there are different variations to that. Here's a couple. Myofascial release, which is kind of a gentle pressure that you apply to release the tension and tightness in the muscle and fascia itself. And then another type of release would be active release or active release technique, ART. And that's where you're actually moving the affected area at the same time putting some pressure or tension in that specific area where you have some tissue tightness. And then the third would be some kind of nerve entrapment release. These techniques you'd use to release some of that tension and compression on a nerve. So you've heard of flossing and that type of stuff. But basically you're trying to address some of these extra tight areas or not. You may have some adhesions. So these are areas where you can kind of palpate around, and if you know there's an area where you have some issues of extra tightness or discomfort through your activity or after, you can palpate around with your hand and see where maybe some unusual texture or tightness. So when you're doing this on yourself, for example, when you have something, a tool like a hard ball, you're really finding that tight area, putting just a little added targeted pressure to it, and then it ultimately will release with that pressure. In the case of active release, you're actually moving the body part around a little bit as you're putting that same pressure, and that'll help to maybe break up some of these adhesions or a spasm, whatever the case may be. So obviously any kind of injury you'd want to check with a physiotherapist, physical therapist, or your physician before trying to address it with some kind of tissue release. But these are things that all athletes and individuals who are getting more active are going to end up with little tight areas and little knots. So if you can use some of these exercises within your motion prep and even your cool down scenarios, it could be very helpful as far as keeping you moving forward in your routine and not having to have some issues that may lead up to injuries.